Hello, my name is Blake LeVine, and I am the author of this book, The Positive Worker, as well as The Psychology of Adult Coloring and Beating Bipolar. Today I want to share my discussion about the future of healthcare. I share about my experience as the founder of BipolarOnline.com, which has currently had the opportunity to use technology to educate people in 350 countries about mental health and addiction. And the future of healthcare is consistently changing, especially as there's so many startups beginning to develop new technologies. We also have companies like Google and Apple and Amazon investing heavily to be at the forefront of the healthcare revolution. I also want to share that with my wife being a physician assistant, she's had jobs at Memorial Sloan Kettering Cancer Center in New York, working in their urology department. She currently is at the University of Miami, where she's a PA for the chief of urology. She's also been in California working for a Cedars-Sinai affiliated urologist. And during her work, I've seen how a robotic prostatectomy became so popular. And just last week, she was in a procedure where one of the doctors, instead of being over the patient with a knife and trying to do everything himself, was sitting in a machine and using the tools from that to have a robotic surgery. And I think this is going to continue to happen in all fields of medicine. In my field, which is therapy and social work, there's many online platforms. I began to use technology by doing Skype and video chat and texting with coaching clients all over the world. As an example, I helped someone in Australia with the simple technologies that were already created. So how will the future be different? And what will it mean for those that are practicing in medicine and other healthcare industries? And what I believe is the technology is already capable of doing so much more. For example, a doctor that's from Spain could be in the US and working with Spanish-speaking patients that are living in another country. He doesn't have to be there, but the problem is not everybody's ready for the outcomes. For example, if something goes wrong, what is the liability? Also, do the other countries have the money to invest in the technology? Can they build a way that the doctors can be in one place and the technology can happen in another? Another part of what's going to happen is it's going to shift what we think. So for many older people, they're used to going to see their doctor, to sitting in his office or her office, waiting. And the younger generations are going to be more open to different and more dynamic ways of getting help. I've made about 850 YouTube videos because many young people sit on their phones listening and learning about healthcare and the things I'm teaching just by watching YouTube. And I envision this continuing even more. So for the future of healthcare, we have to think broadly and deeply and come together to work to make things better. And we also have to make them safe because, for example, if someone's doing a doctoral procedure over the computer, what happens if it goes wrong? Or what if they're giving advice? Many doctor apps can have you take a picture of what you are facing and then give you a diagnosis or tell you what's wrong. And what if they're wrong? What are the outcomes if someone gets injured or someone ends up having a misdiagnosis? And is the liability too great for these technologies? And are we capable of protecting both the practitioners, the healthcare companies, and maybe even the patients? So I want to thank you for watching my brief video. These are a couple of books I've written, and I look forward to expanding on this topic, hopefully at your event.